This video is on the A to E assessment, which is part 3 of your clinical assessment. Your first step is C, your catastrophic hemorrhage. At this point, you should be looking at your patient and checking for any major bleeding. This needs to be controlled before anything more can be done. This may be where a tourniquet is needed. There is a picture here that shows a regular tourniquet that may be provided to you. Next, we move on to A, which is your airway. Here, you need to look, listen, and feel. Look for any obstructions or swelling down the patient's airway. Listen for any noises, for example, snoring, gurgling, or even silence. Feel for any off-air movement. You may need to reposition the patient's head, potentially suction out anything obstructing the airway, and possibly use an OPA, an NPA, or an eye gel if this is required. Next we go on to B, which is breathing. Check the rate and the depth of the patient's breathing. Take the SpO2 reading from the patient. You can use IPAP, which is inspect, palpate, oscillate, and percuss if required. Get a peak flow reading if it is required. Make sure that you get an EtCO2, which is an end tidal CO2 reading. Administer any oxygen or drugs that are needed here. Next, we move on to C, which is circulation. Check the patient's pulse rate, rhythm, and volume. See what the patient's skin colour is like, along with the skin temperature and moisture. Get a central and peripheral capillary refill time. Take a blood pressure reading from the patient. Put on a 3-lead monitor or a 12-lead diagnostic ECG lead if it is required. Check for any blood. Is there any blood on the floor? Is there any blood potentially in the cavities of the body, such as the chest, the abdomen, the pelvis, in the long bones? At this point, treat the patient the best you can. Next, we move on to D, which is disability. What is the patient's response like? This is when you check for AVPU. A, alert. V, responds to voice. P, responds to pain. Or U, unresponsive. Check your patient's pupils. Check their size, equality, are they reactive to light? Check the patient's temperature. Take a blood glucose level if required. Do a fast test. So face for F, arms for A, speech for S, and treatment or time for T. It's now time to treat the patient. Finally, you move on to E, which is expose and examine. Check the patient's head, abdomen, and back. Check their arms and their hands, and along with their legs and their feet. Maintain the patient's dignity though, and keep them as warm as possible. This is your third step in your clinical assessment.